How does chimerism affect lymphoma stem cell transplant outcomes? Chimerism is an important concept in the context of stem cell transplants, especially for patients with lymphoma. It refers to the presence of two genetically distinct populations of cells in a patient after receiving a transplant. This usually includes cells from both the donor and the recipient. The degree of chimerism can significantly impact the outcomes of stem cell transplants, particularly in cases of non-Hodgkin lymphoma. When we talk about chimerism, we often distinguish between complete donor chimerism and mixed chimerism. Complete donor chimerism means that nearly all blood cells are derived from the donor. This condition is generally linked to a lower risk of lymphoma returning and better survival rates after the transplant. In fact, having high levels of donor chimerism early on can predict a reduced risk of disease relapse and better overall survival. On the other hand, mixed chimerism, where both donor and recipient cells are present, can have varying effects. Low levels of mixed chimerism might indicate a state of immune tolerance and could be associated with a lower risk of graft-versus-host disease, a common complication after transplants. However, if mixed chimerism persists or if recipient cells exceed certain levels, it can lead to higher risks of graft failure and disease relapse. Research shows that even small increases in donor chimerism can correlate with a significant decrease in the risk of relapse. For instance, patients with 100% donor chimerism have a much lower projected relapse risk compared to those with 90 to 95% donor chimerism. Monitoring chimerism levels early after the transplant is crucial. It helps guide clinical decisions and can indicate whether additional interventions are needed to prevent relapse or graft failure. Chimerism also plays a role in graft-versus-host disease. Complete donor chimerism is often associated with a higher incidence of both acute and chronic forms of this condition. This is likely due to the stronger immune response from donor cells against the recipient's tissues. In contrast, mixed chimerism might reduce the risk of graft-versus-host disease by promoting immune tolerance, but this must be carefully weighed against the risks of increased relapse or graft failure. The impact of chimerism on transplant outcomes can also depend on the type of lymphoma, the conditioning regimens used before the transplant, and individual patient factors. For lymphoma patients, achieving high donor chimerism is generally favorable for controlling the disease. The intensity of the conditioning regimen and the number of stem cells infused can influence chimerism dynamics and overall transplant success. Regular monitoring of chimerism post-transplant is essential. It allows healthcare providers to identify patients who are at a higher risk of relapse or graft failure early on. This proactive approach can lead to timely interventions, such as donor lymphocyte infusions or adjustments in immunosuppression. Understanding the patterns of chimerism helps balance the risks of graft-versus-host disease and relapse, leading to better management of each patient's unique situation. In summary, higher and stable donor chimerism levels are associated with better outcomes in non-Hodgkin lymphoma stem cell transplantation, including lower relapse rates and improved survival. Mixed chimerism presents a complex scenario, balancing the risks of reduced graft-versus-host disease against the potential for increased relapse or graft failure. Ongoing monitoring of chimerism is vital for guiding post-transplant care and improving patient prognosis. Always consult with healthcare professionals for personalized medical advice and treatment options.